So I'm here tonight with my son, John. He's a senior in dental school as well at Ohio State. My alma mater. Went to school there for 8 years. Graduated from Ohio State. I did a year residency in hospital dentistry, and then came back to Columbus to practice. And I also practice in Columbus. So yeah, it's been really fun. We don't get a whole lot of nutritional information about. I mean, we learned Krebs cycle and how metabolism works and all that. But as far as a functional implementing part of our practice, we don't get a whole lot of that. And it's really ironic that in our profession, compared to others, I mean, it's a nutritional, our disease process is a nutritional problem. One of our number one culprits is sugar, right? So if there weren't processed sugar, we would have a whole lot less business in our profession. So it's somewhat ironic that I have had nutritional counseling from my first day in practice. But it wasn't necessarily addressing full nutrition. It was addressing how the etiology of decay works, which has a sugar basis over carbohydrate basis. So it's really kind of fun to actually shift gears and say, okay, look, giant step back. The person that brought these teeth in has to be cared for, and that person is going to be assessed through a nutritional test. So the scanner's been very functional for us in that regard. Our two disease processes are that we focus on, and the reason why dentistry is focusing on the scanner is because of periodontal disease, which is prevalent in 92% of our patients, or 42% of our patients coming in, and because of the high and increasing demand for dental implants. For a dental implant to be successful, we need to have bone health. Bone health and nutritional wellness are totally connected. So it's been really nice to be able to know that when we care for folks for those two disease processes primarily, we're addressing it from a health and wellness standpoint. One of the sayings we have is your mouth talks to your body, which we have been professing for a long time, but it's also true that your body talks to your mouth. So if you just make their mouth well, you need to have a body to help perpetuate that. So John, do you want to say anything in addition to that about, we've used the scanner in all three of our practices now. It's only been about a year, thanks to Dr. Feltz, mi compadre, and it's been phenomenally successful. We use it every day, and really, in all three practices, we use it a lot. So,
right. Well, my experience with it, I went to Utah back in November, and I had a pretty similar position towards it as Dr. Arturo. He was saying he's skeptical. All my professors are saying you need to have evidence-based facts to implement into practice, and so I was skeptical about applying nutrition because it's not necessarily something that I'm being taught. Although they do talk about the importance of it, they don't really tell you how to implement it. And so after going to Utah, totally blew my mind with the amount of quality control and the amount of scientists, meeting the scientists, just like Dr. Arturo said, and seeing them present all the science between why their product works and why it's good for your patients, and it was awesome. So I'm all in on it.
He's a quicker study than I had to go 4 times to actually comprehend it. I was like you, Arturo. It took a minute, but
And how, Dr. D, how's your team done with the program and the device? Your staff.
Well, that was really cool. That was one of the first things we did. Was one of the reasons that I was so adamant to kind of get involved was because I really care about them. So we employ about 25 employees, and not like Dr. Feltz, he's got a whole bunch more, but it's just a small, intimate group, and I really care about them. And so getting them scanned was super big, and what it did also for them was it made them believers. So they were super excited about getting healthy. One of the things that, I don't know if you guys have talked about this, individually, but not all of our patients are interested in wanting to know and be healthy. and they want to get their teeth cleaned. They don't want to know about nutrition. They don't want to know about other things. And so we separate that group when we ask them, you know, are you interested in this? And if they say yes, we carry forward. But the team is very enthusiastic about it, and sometimes they just can't help but talk about it with them. So it's really to that point, you know, during this quarantine, what is super important to every one of our patients and every one of us as parents and leaders in our family is their wellness. Their immune systems are super important right now. I mean, it's number one topic on everything you hear and see. I mean, what a greater way. You see masks and gloves. Okay, I get all that. And we're going to end distancing. I get all that. But how about having in your body a ramped up, totally Teflon immune system? I mean, blueberries, blackberries, absolutely. But your nano and your life pack, for Pete's sakes, don't forget that. You know, so that's kind of where we've been at home. And yes, and measuring and then remeasuring, right? Because we've had Mamacita in our house is like the boss, right? So she started off on her own. She was like, Dr. Phelps calls it a lie detector, or what's your word for that, Andy? What do you call that?
What, the nutritional lie detector?
Yeah, well, when she gets a 52 without taking any Pharmanex.
Oh, the test is agnostic. So I love it when people test high when they don't take Pharmanex supplements, because it proves the test is agnostic. It's not a Pharmanex detector.
Right. So mom scores a 52 right off the bat, not taking any supplements. Well, guess who got down to like a 43, and we all screamed like, "Oh my gosh, come on, kids, we'll share. You can have some.
Right.
Don't let that number fall now." Right. So
especially now that I beat her with the 55.
Yeah. So
oh, Johnny, nice. Right.
So I know it's a little off topic, but I mean, for all of us, for Pete's sakes, this is a time for everyone you love. Arturo, to your point, all 28 of yours. We only have 5 in our house right now. It's a little quarantine, but hey, we want all those numbers to be crazy high. So, right, it used to be that you never even got the conversation. You didn't get a consult. If you smoked, you don't get an implant. Back when this is my 35th year, when implants first began, like in those years, wasn't even thought about. I mean, it was just, you get up, and not until you quit smoking and you've been off, nicotine for a while, then we'll talk about it. And we got a little, in my opinion, loose with that. I don't know if it was a matter of just, maybe we felt the products became better and overcome that. I think it's going to come down to that, Mike. I really do. I mean, I think it's going to be where we have a whole lot more scrutiny in who we pick. Well, here's the thing. We can fix that. I mean, that's not you can't make me 6'2" with blonde hair. I can't do that. But you can make my immune system healthier. That's very, so it's a problem, but it's a manageable problem.
To know what's the number 5 reasons a dentist should do this.
Okay. Okay. Number 1, for soft tissue wellness. Our number 1 disease process is periodontal disease. 42% of our patients have it. You need to have soft tissue wellness. Number 2, bone wellness. It's probably one of the things we have. The number 1 loss of reason for loss of teeth is also because of the bone that supports our teeth and not being well. We call that disease periodontal disease. So to help fight periodontal disease. Number 3, I think understanding that our patients have an overall, we're healthcare professionals, so their overall wellness, just having all the like we talked about, the micronutrients, the micro minerals, the whole cascade of trying to eat 6 to 8 servings of fruits and vegetables and all that they contain. So just an overall wellness standpoint. And I'll add the last 2, how our country right now is divided both with wellness and business. I'm going to add the last 2 for business. Number 4 is in our office. It offers a huge income potential for our team, the way we structure our incentives. So it helps to make them, to help to support them financially. And then number 5, if like in Las Vegas, if the house isn't good, nobody's good, right? You don't have lights, you don't have machines. So it helps keep our business well. It's an income stream. It's not a huge income stream, but it's a substantial income stream. and so it helps with that as well. So those are the 5 reasons.